Hello, everybody, and welcome to the JB Glossinger Show. I am so glad you're with me. As you know, I'm the founder of MorningCoach.com, and I'm excited to start a new interview series. And we're going to have some experts on that are going to discuss different ideas and thoughts about life and health and everything that's going on in the world. And today I'm really excited to bring you our first guest as we start this new format, Dr. Paul Kilgore. Dr. Paul, how you doing?
I'm doing great, JB. It's great to be here with you. Thank you very much.
Great. I'm so glad you're here. And as you know, I've asked you to be here because we've obviously got the Morning Coach community, and a lot of other people that listen to me are business owners and entrepreneurs and coaches. And right now, kind of the thing that's happening in the world today is the coronavirus, right? And so what I would like to do is I'm bringing you on to kind of talk a little bit about that. But if before we get going, could you tell us a little bit about your background? Because you've got this wonderful, you come from the public health side, and you've really understand this in a kind of a different light as a research physician. And can you kind of let everybody know who you are?
Oh, you bet, JB. Thank you very much. Yeah, you're absolutely right. My background has actually started out in public health. And a part of that public health we call epidemiology. And that's really the study of patterns of disease in human populations and animals. And then I also did clinical training in a specialty called internal medicine. So I have both the public health side and a clinical side that I bring to bear on, answering and solving health problems.
Awesome. And where are you located?
I'm up in Detroit, Michigan, and I work at Wayne State University in Detroit. And I live in the Southeast Michigan area, but I also do a lot of traveling internationally. So I have a good sense of what's happening out there.
Okay, awesome, awesome. Yeah, I know you've been doing some speaking recently, haven't you? Over in was it Asia? You were over there a couple weeks ago.
Yeah, that's right. Yeah, in Asia and some parts of Europe as well.
That's awesome. Yeah. Well, as you know, I'm a pretty straight shooter when it comes to life, and obviously my expertise is not health, but we've got this coronavirus. A lot of people call it the beer. I want to take it serious, but the beer is actually getting more searches on the internet than anything because the beer is Corona out of Mexico, right? So it is getting a lot of searches. But my fear is always, I think the term is pandemic. That things start getting out there, and we're getting a lot of different news sources saying different things. And my concern really is, how do we get through all the information to understand how much of a threat do you really feel this is? Okay. And that's kind of what I want to discuss today. And then not only whether it is or isn't, okay, and we'll talk a little bit about that in your professional opinion, but also, I think just overall health, what can we do for ourselves to keep ourselves protected from a virus like this or other viruses? Is that cool?
Absolutely. That's great. Those are very, very important points to talk about.
Okay,
Yeah.
great. So let's start with the first one. So the media, depending on who you listen to, I got a Facebook post. I got 2 private messages from some videos of things that the government, people saying the government doesn't want you to see this, right? So from your professional opinion, I just want you to hear, where are we at with this thing? What's going on with it from the non-traditional media sense?
Yeah, that's a great question. So there's a couple of things I think for people to know. First is that when you're looking for reliable information about the coronavirus and the epidemic, I think there's a couple places that you can go where you're going to get reliable, accurate information. The first is a website of the Centers for Disease Control and Prevention. So that's cdc.gov. Okay. That website is updated daily with information about the coronavirus and its effects. And so it's a really useful source. The other one is the World Health Organization. You can start to see kind of international patterns of disease and also what people are doing around the world to help combat the epidemic. Another source that you can go to is nih.gov. It's the National Institutes of Health here in the United States. So that's nih.gov. There are also several universities that have good websites as well. And so those are available, and I can send those to you, or we can put them up on the website maybe later.
Yeah, fantastic. Well, one of the things we'll do is make sure we give your website. What is your website that people can go to?
Absolutely. It's quantitative hyphen health, QUANTITATIVE hyphen health.com. And I'd be happy to talk to anyone who has a question about this coronavirus as well. And also, they can email to me with questions, and I can provide information to them or point them in the right direction to get really good information.
Okay, fantastic, fantastic, and I'll make sure we put that in the notes and on the website. So if people want to click that link, and you can talk to Dr. Paul Kilgore here with this. So a little bit into it. Okay, so you're giving us some good information to go. What are your thoughts on this as a public health, not only a professional but a research scientist over the years of where we're at with this thing?
Now, that's a great question. So, when I look back over, say, the past 30 years, and look at different epidemics and disease problems we've had, there's no doubt that the coronavirus that we're having now is one of the most important situations in recent history. But we've also had other major epidemics and pandemics that we've seen actually in the fairly recent past, one of which was the flu pandemic in 2009. And actually, the impact of the flu pandemic that we had was more widespread than the current coronavirus problem. And the impact in terms of number of cases and deaths was much larger than what we've seen so far with the coronavirus.
Wow. Okay. And can you tell me the difference? I mean, I think a lot of us are we don't know a lot of the public health stuff, and I use the word pandemic. What is the difference between a pandemic and an epidemic?
That's a great question. So, when we talk about epidemic, we generally think of a fairly limited population. So, it could be in a city, it could be in a county, it could be in a country, and or it could even be in multiple countries that are either next to each other or separated. Then we talk about the next level, which is a public health emergency of international concern. So that's a WHO international health designation that really tells us that it's kind of gone from the level of an epidemic into involving many countries, usually several countries on one or more continents. And so the reason they do that is to be able to help facilitate decision making in public health at different country levels and across different regions. Now, when we talk about the pandemic term is really reserved for a disease that's spread globally. And when I mean globally, I mean to every continent. So when we think about a pandemic, we're talking about not only North America, we're talking about South America, Africa, Europe, Middle East, Asia, and all over each one of those regions. And, we've had smallpox pandemics, we've had influenza pandemics, measles has spread widely, but we've not seen a coronavirus pandemic in this sense yet. And the reason, in part, is because we haven't actually had cases reported from South America. And you could also argue we really haven't had cases yet reported or confirmed from Africa. Middle East has been affected, but really only one country, and that's been pretty much it.
Okay. So we haven't reached pandemic proportions, but it's still something we need to be concerned about.
Yeah, absolutely. Absolutely. And as families or individuals, when you think about protecting yourself, there's definitely certain things that you can do that can help protect yourself and your family and loved ones and even your coworkers.
Let's talk about a few of those things. So, from what I'm hearing now and listening to you, this isn't something we need to go out and panic and run to the raw greens and buy a bunch of masks and sanitizer and freak out on this. But it's something that an ounce of preparation. Maybe there's some things we can do to just make sure we're prepared.
That's right. So, one of the things I should probably mention is what the disease looks like. So, that gives you some idea of what the preparations would be. Is that okay?
Yeah, please.
Okay. So, coronavirus disease looks a lot like influenza in the early stages. And what I mean by that is that people develop fever and cough and muscle aches. So, when the cases were described of coronavirus in China, and that description came out in the news, actually came out last week in a good description in the journal JAMA. And when they looked at that, they actually found the cases were really coming up with signs and symptoms that look a lot like what we've seen in other diseases. So I mentioned fever, fatigue or feeling tired, a cough, typically a dry cough, which means that you're not coughing up a lot of phlegm or blood, muscle aches and pains in your muscles, even when you're sitting down or just lying down, shortness of breath or feeling winded when you're walking and sitting down. And then you have these less common symptoms like headache, dizziness, belly pain, diarrhea, nausea and vomiting can occur. And that nausea and vomiting can even occur before people get fever and shortness of breath. And so the time from first symptom observed to the time that people have more severe signs like shortness of breath, it's about 5 days. But if you start to see those early signs and symptoms like fever, fatigue, muscle aches, dry cough, it's not too soon to go start seeing your doctor.
Okay. So if you're seeing some of the symptoms, more than likely it's probably the flu because it's not really here yet. But it doesn't hurt to see a doctor if if you're seeing some of the symptoms.
No, that's correct. You're right on. In fact, the reason I say that to people is that we do have a good diagnostic test here for influenza, and we do have a good treatment for influenza. And I've been talking with a number of my colleagues and friends who have gotten flu this year, and I asked, were they able to get that laboratory test done, and could they get treatment? And the short answer is yes. If you get in to see your doctor, you can get diagnosed and treated pretty quickly, which is a great thing because sometimes, depending on who you are, influenza can be very severe.
Okay, so yeah, and it shares similar characteristics then. So the coronavirus shares similar correct characteristics. So the thing is, what can we do to, you see these people in Japan wearing masks and you see, in China wearing masks. Do these things work? I mean, what should we be doing if we're traveling or if we're going to be someplace where we're around a lot of people? What are some preventative things we can do?
That's a great question. So, for sure, if you're doing international travel, I would be recommending someone to carry a mask. You may not need to use it, but just have it handy just in case. There's a special type of mask that does filter out viruses, and it has a number on it. The number is called N95. N as in Nancy, never, and 95, 95. And the other thing the mask should say on the packaging is OSHA certified. That's the Occupational Safety Health Administration, OSHA certified. And the N95 OSHA certified masks will filter out 95% of the small particles, including some viruses that you may be exposed to or could be breathing in.
So if you are traveling, you would suggest this, and specifically in the particular areas, it doesn't hurt to throw on a mask, depending on where you're going.
Yeah, in the United States, since we do not have circulation really documented or widespread at all for coronavirus, I would say wearing a mask in the United States is probably not something you really need to do. But the other things that you can do, which are very simple, I think, is just be wary and vigilant for signs and symptoms in yourself and family members. So looking for that fever, those muscle aches, those kinds of things are very important. And then if you do get sick, I would recommend going to see your doctor, healthcare professional, to get tested, checked out for flu, and just looked at, because when a physician or another healthcare professional lays eyes on you as a patient, that can be actually somewhat reassuring in the sense that they can tell you, if it looks like things are moving in the right direction or that you may need more help.
Fantastic. So that, and I think that's a great tip, right? So if we've got symptoms, it doesn't hurt to go get the check anyways, right?
Exactly.
What are some things we can do just on an overall public health situation? Hand sanitizer, washing your hands. I mean, I've heard so many different things. Don't touch your nose. Take vitamins before you get on an airplane. I mean, what are some things in an overall health situation? I mean, I consider myself very healthy, but what are some other protective things without being a hypochondriac, right? And going OCD on this, that a regular person like myself could do that's going to protect me a little bit more from some of even the influenza virus.
Yeah. So there's some simple things that you can do. So one, of course, is washing your hands. So good, we call that good hand hygiene. And what that means is that, before and after you're using food, or if you're using the bathroom, wash your hands. Also, if you've been outside, out of doors, and coming into your home, washing your hands as well. That can also be a good thing. I would also recommend that if you do have a cough or sneeze, that you cover it up, and you can cover it with your sleeve like this, your elbow or your forearm, or if you have a handkerchief or a towel or a Kleenex, you can cover your nose as well. The idea there is to prevent you from spreading the germs and any airborne particles to someone else, because one thing we know is that coronavirus can travel pretty far in airborne droplets. And we call these respiratory droplets that can actually carry the virus inside them and move from one person to another that way.
Okay.
You can also avoid sharing household items if you're sick. And if you are sick at home, trying to keep yourself relatively separate from other individuals in the home. Of course, that can be practically very difficult if your home is not very large or if you don't have multiple rooms. But keeping that separation, that distance between individuals is also a good idea if you have symptoms.
Okay. And like carrying hand sanitizer, does that stuff work? I mean, is
Yeah,
it
that can't hurt at
doesn't hurt?
all.
Okay. That's kind of
Um,
keeping in with your, good hand hygiene that you said, which I like that.
yeah,
Hand
yeah,
hygiene. That's kind of a cool thing. That sounds like a book title, proper hand hygiene. Well, or you know
yeah.
what it sounds like? One of those, things when they used to roll in the projector when we were kids. Okay, we're going to show you proper hand hygiene today. I love it. We gotta laugh a little bit too, right? If we're not laughing, we're not learning.
Absolutely.
So
That's a
it's
great
great.
point.
Yeah, so it's great. So it's cool that we're kind of getting this information. So, one, we're not in a panic situation, but we should be aware. Am I correct in saying that?
Exactly. That's exactly right. You nailed it perfectly.
So we want to follow the CDC.gov, the World Health Organization, or the NIH.gov. Is that one you said, the third one?
Yeah, it's nih.gov can have
Okay.
good information
And of
too.
course, your website, you're going to have, people can come there and stop by and see you, right? And
Yep,
it's
absolutely.
quantitative/health.com, and we'll put that in the link. What other
Sure.
passing points do you have? Now, what I'm going to plan to do is have you on the show more. So if you've got any
Yeah.
questions for Dr. Paul, and I think we'll call you Dr. Paul. You don't mind that, or Dr. Kilgore?
Either
Which
one is great. Yeah. Either
Okay.
one works, definitely.
Great. So if you're listening, you have any questions, let's get Dr. Kilgore back on, or Dr. Paul, and discuss some of these things. But what do you have? Do you have anything in closing that you would want to tell people as they're kind of getting more concerned about this thing?
Yeah, I think first thing is don't worry and don't spend a lot of time losing sleep over this. I think the other thing I would say is adopting other healthy lifestyle habits that support being disease free in general or helping to stay well are great things. Like your sleep hygiene is very important. Sleep can help boost your immune system and keep you strong so you can actually fight off infections. So that's very important. So sleep is a great thing. Eating proper, good diet is very important. So lots of fruits and vegetables is very important. And that can actually strengthen your immune system as well and help boost all those things like uh, T cells and B cells that make the protection we need to fight off these infections. So that's important. And I think just being aware of how you feel, um, don't put yourself under too much stress. And if you feel like you're under stress, in my podcast, the Quantitative Health podcast this week, I've been talking about stress. We're going to be talking about it all month, actually, because for me, I see stress as the one thing that is at the focal point of all other illnesses. And it actually can relate to heart disease, obesity, diabetes, cancer, infections. So if we can help find ways to reduce our stress, we can actually protect ourselves and prevent a lot of diseases.
I love it. Well, that's great. I think it's good overall advice, anyways, right? We should always be on a health kick. It's one of the reasons I want to get you more involved in the things we're doing. And so if you have any questions for Dr. Paul Kilgore, please, shoot him over. He also has his own podcast, and that is Quantitative Health, right? If they search for you, Dr. Paul Kilgore, they'll find that, right? And can listen to some of your information. And we're going to have him back on the show. And Dr. Kilgore, I really appreciate you being here. I'm glad you're involved in what we're doing, and you're lending your expertise in the health area.
Thank you so much, JB. It's great to be here and happy to return anytime. And just give a call. I'm happy to be there.
Awesome. Well, everybody, thank you so much for watching. Hopefully you're feeling a little more secure about the coronavirus. And I have a lot more coming for you. So no matter where you're listening to this or watching it, make sure you subscribe and share it. And if you want to find out more about all of us and the experts and the things that we're doing, head on over to morningcoach.com. So thank you so much for being a part of this. And we will be back with more soon. So make sure you subscribe, like, rate, share, all those wonderful things. Okay, we'll see you later. Bye.